Welcome to a special episode of BeeWellwithMS podcast. I'm your host, Dr. Agne Straukiene, neurologist. And today I'm excited to bring you my reflections along with those of my esteemed colleagues from ECTRIMS 2024, held recently in Copenhagen. This year's event was truly inspiring, with over 8,000 people coming together to discuss the latest in MS research and treatment. It's moments like these that remind us how much progress we are making, even as we face new challenges. A key highlight at this year's Congress was the emerging evidence of high-dose vitamin D3. If you're known to have MS, you should be by this time on vitamin D3. Recent research suggests that high doses of vitamin D3 may help to slow down MS progression, particularly in early stages. While we still need further studies to fully understand its long-term impact, this is definitely a promising development that could change the way we manage MS in the future. During this event, I had the chance to catch up with several of my colleagues who shared their own insights and reflections on some of the key discussions from ECTRIMS. We spent a lot of time talking about the much-anticipated Hercules and Gemini trials of the BTKI inhibitors. You probably heard that before. I mentioned in a few previous episodes. It's called tolebrutinib, one of the agents in multiple sclerosis, a new one that has been studied and investigated. While the trials didn't meet the primary goals for reducing relapse rate compared to the teriflunomide, there were still positive outcomes. The reduction in 6 months confirmed disability progression in non-relapsing secondary progressive MS. So people who's got progressive nature of MS but don't present with the relapses, that's the type of MS that has been referred for this particular trial. And it was seen as a silver lining, and we are hopeful that future analysis will guide us even more insights. Another pivotal moment was the update on the new McDonald's criteria for diagnosing MS. This is now called McDonald's criteria 2024. Before that, it was McDonald's criteria 2017. That was the latest, the update before this year. Presented by Professor Xavier Montalban, this update, which includes imaging biomarkers such as the central vein sign and paramagnetic rim lesions, represents a shift in how we can approach earlier and more accurate MS diagnosis. These changes will undoubtedly help us identify MS in patients earlier, even before they show obvious symptoms. Statins were another topic of discussion, quite often used in cardiovascular diseases, but it's been trialed in people with secondary progressive MS. Sadly, a major trial showed that statins don't appear to slow the progression of secondary progressive MS, which was disappointing news for many. However, it's a reminder of just how complex MS is and how much more we still need to learn about finding the right treatments for different stages of the disease. Throughout the conference, I had the pleasure of speaking with several peers who shared their own perspectives. Many echoed similar thoughts about the trials I mentioned, but also emphasized the importance of pushing forward with innovative outcome measures to better understand disease progression. One particular reflection from a colleague resonated with me. We are at a point where we need to evolve how we measure success in MS treatments. And it's not just about reducing relapses, but also about slowing down progression and improving quality of life. So let's tune in and listen to my colleagues who provided their insights at the venue of ECTRIMS in Copenhagen 2024. So hello. I met with a wonderful scientist. She is Iris Katharina Panner. She's based in Switzerland, and she's a neuropsychologist, right?
Yes, by training, and a cognitive neuroscientist.
Cognitive neuroscientist. I don't meet regularly cognitive neuroscientists. She's the very first for me. I'm so excited to ask a few questions about her highlights at the ECTRIMS in 2024. What did she learn in the last couple of the days that we attended the same conference? Hello, Iris.
Hello, everybody. So I'm attending the ECTRIMS conference in Copenhagen since yesterday. And yesterday, I think there was a very important session on fatigue and sleep. Being aware that fatigue is one of the most common symptoms in multiple sclerosis, I thought that this session has a huge impact. And we discussed there the relation between fatigue and depression, and also how to disentangle these two conditions. Then there was a presentation by someone on imaging fatigue, and I think that it was only one session on that topic, and I would have loved to see more. Because I think that's so important. Also, a session on cognition would have been nice, but unfortunately, this year this wasn't in the focus.
Yes, yeah. Appreciate for the listeners. Fatigue is the most commonest MS symptom as far as we know. That's science-based evidence that we have that there are so many other MS symptoms, but fatigue is the top one, and it's also a biomarker of the early progression and early cognitive issues may start with the fatigue, and also one of the symptoms of depression. So sometimes it's difficult to distinguish fatigue versus depression, whether it's depression dominant or is fatigue is a symptom of MS. But this is super important. I think we would love to see maybe next year to have more sessions on fatigue, cognitive function as an early biomarker and sign of the multiple sclerosis and multiple sclerosis activity as well as progression of MS. So thank you, Iris, Katharina, and I'll see you very soon. Next year.
So
I am at ECTRIMS and I'm seeing a few more colleagues of mine, and I've got a beautiful colleague, Katie Patharam. She's a friend of mine and a colleague here, and I'm just asking about a few highlights from ECTRIMS 2024. We are both attending this conference in Denmark, Copenhagen. So Katie, what's your highlight from this meeting in Copenhagen?
Well, thanks very much for asking me. I think obviously the new diagnostic criteria is what everybody's been looking forward to. And I think there's still some details to be ironed out, but certainly earlier diagnosis, if patients have a certain MRI findings, going to avoid LPs, which is going to be useful. I just went to the new therapeutics session, and the Delay MS vitamin D study was presented, which does seem to suggest that in patients with an early CIS without spinal cord lesions may benefit from high-dose vitamin D. So, yeah, lots of exciting things going on, so thanks for asking.
Thank you. Wow, the vitamin D plays a key role here, so that's amazing. Oh, that's good to hear. So if you are not taking vitamin D3, it's time to start taking vitamin D. And in particular, if you are known to have clinical isolated syndrome or radiological isolated syndrome, this is the time for you to look after yourself and take the vitamins. Maybe add extra omega-3. That's also helpful for your cardiovascular system. So, but vitamin D is the essential one. So,
the essential one, for sure.
Yeah. All right. Thank you. No worries. So I met German neurologists, famous guys here. So I'm really excited about this, and I'm just asking about the ECTRIMS highlights. So I got in front of me Dr. Hernan Inoyosa. I'm not sure whether I'm pronouncing it.
Right, okay.
Inoyosa
in Spanish, if you want.
Inoyosa, okay.
So that is our new weapon from Venezuela, coming to now being in Dresden and doing research.
Okay. So what's your highlight?
So if you ask me that quickly, I would say just there is new definitions, new diagnostic criteria, and it's a little exciting what with the radiological isolated syndrome will happen with new classifications as definition from early multiple sclerosis and potential treatment consequences.
Yeah, we are living in a new era of early diagnosis. I'm not sure how we're going to end up in misdiagnosis. I think it's around 20% it happens in our world, so I'm slightly worried. But I've got my academic research mentor, Professor Siemsen. I'm so excited to stand next by him at this busy environment in Denmark, Copenhagen, 2024. And Prof. Siemsen, what's your highlight from ECTRIMS?
Of course, everyone is telling you the new diagnostic criteria, and I'm usually not following the mainstream. That's why, of course, not. I think I think, we are still together as well in the digital stream, and I think we have a very nice possibility now to move forward, and now phenotypes, AI-driven, now integrating data, and I think it's a little bit a pity that all this digital stuff is very dispersed between different sessions. So tomorrow we have our session where we look for our vision of our digital twin, and then we have the digital biomarkers, MRI analysis, and so on. I think integration, multimodal analysis, that is what we see here. Unfortunately, it's not so much brought together. It's still a little bit separate. I think looking at the topics here, what we have to achieve is to bring topics together, not the MRI group always together, then the biomarker group always together. I think what is really necessary that we exchange, that we bring factors together, and I think then we have a bright future. Yeah, so we can use a lot of data which have not been available 5 or 10 years ago. We have to use this data, and then I think we will got to some clues in the field of MS.
So as you noticed, this is super insightful overview of the highlights that Professor Simpson just took into his account. And digital technology plays a role here, but as you can see that interconnectedness of multiple domains that needs to be bridged and linked together to make the robust, smart decisions towards patients' early diagnosis and early treatment. That's why we are here.
I think it's even if you look in your hospital, so you have so many diverse data, and of course what we are doing is that although we have data from different sources, we bring them together in our mind. And I think if you have a process that this is done in a common data space, and if you have so-called NMS data warehouse where you can apply everything what you see available from the MRI, from the digital biomarkers, from the lab, and so on. So take it out of like a supermarket where everything is available, and there we have to work for it because what does it help you if in principle we have the data, but we have them only in principle, and we cannot use them. And at the moment, the data integrator is the neurologist, and of course that is fine. And I think we need neurologists, but on the other side, it's good if this duty that data are connected and that we have a NMS data warehouse which can be analyzed. I think that we have this approach available in each neurological practice.
Yeah. Totally agree, and I think we are discussing about the self-efficacy, self-management, and some people listening to us and say, "Ooh, digital technology! Ooh, this is not my area." Actually, it plays a key role in combining these multiple domains together and producing the reports and outcomes that we as clinicians could make the more robust decisions towards your care, your trajectory of the disease to improve that, and that's our ultimate goal and agenda.
Yeah, and speaking about our center, I think I can say that our patients, they like to collect this data, and if, for example, a data initiative is stopped, they're really a little bit, where we can collect this data, I would like to have this self-measurement, I would like to have this data available, and that's why I think it's key to be patient-centric in this context, and a lot of things, of course, if you look here at the conference, are still lacking the patient centricity. So if you have the high scientific, very elaborated MRI analysis and a 7 Tesla scanner, of course the patient is quite away. And I think that, again, that is our activity. I think the need for our activity that we take our patients with us, and that we do something, a co-creation together with them. That this multimodal analysis is really done in a way that the patient can use this data as well.
Yeah, so remember, we are developing these tools and digital technology for you. So we expect you to be as part of our community, as a scientific group member, influencing scientists with the decision-making processes to develop a tool for you. So no matter who's going to run the digital project, always remember to take into account patient representative, and get involved from the early stages of the clinical trial. That is the tool created, personalized to that individual living with multiple sclerosis. Thank you for this interview.
Thank you so much.
Well, I just met at ECTRIMS one of my followers for BeeWellwithMS. He's Wim Koudijzer. How I don't know. He's going to pronounce the surname. So what's your highlight? What have you learned from ECTRIMS this year?
Oh, I learned there are new therapies coming, but I think they are far away from here, so we have to be patient. And for me, I believe more in holistic and mobility activation. Because I have MS, and I feel more comfortable with exercise, and I don't believe really in a lot of high efficacy therapies, because I think they will block my ability to move, and I feel when I move it goes better. I have PPMS.
Okay, well, thank you so much, Wim, for your opinion. It's really nice to hear that from a person living with MS and who is attending ECTRIMS conference this year in Denmark, Copenhagen. Thank you so much. Hearing my colleagues' views added more layers to the discussions we had at ECTRIMS. We all left with a sense of renewed motivation, knowing that the road ahead will require ongoing collaboration and commitment to find better solutions for our patients. To wrap up, it's clear that ECTRIMS 2024 has once again highlighted the importance of collaboration in the fight against multiple sclerosis. While some trials didn't bring the results we hoped for, others opened new doors of understanding and possibilities. I want to thank my colleagues for sharing their valuable insights throughout the event and for their ongoing dedication to improving MS care. I hope today's episode has given you a good sense of what's happening in the world of MS research. As always, thank you for listening to Be Well with MS and stay tuned for more updates. Remember to keep thriving on your MS journey, and together we will continue to push the boundaries of what's possible.